Okay, Timmy coming at you again. Here we go. What I'm going to do for you today is talk to you about diuretics and how they work. Um, so, first of all, a couple of things. I'm going to show you a little video here. Maybe. As you know, you got two sides to your heart. You got your right side and your left side. Here's the important piece. The right and left side pump exactly the same amount of blood. The right side of your heart, right atria, right ventricle, pumps the venous blood, the deoxygenated blood, the blood that's high in carbon dioxide and low in oxygen, to the lungs to get oxygenated. That blood that's oxygenated then comes back to the heart, the left side of the heart, left atrium, left ventricle. Again, the primary pumps of your heart are your ventricles. Again, critical, the right and left side of the heart pump exactly the same amount of blood. So, where does the left side of the heart get the blood? It gets the blood from the right side. Where does the right side of the heart get the blood? It gets the blood from the venous system. And write this down, tattoo it someplace. All venous blood returns to the right side of the heart. The right side of the heart is a low pressure system. What that means, just real quick, hang on here. The right side of the heart, right ventricle, low pressure. That says right heat. Cut it out, Timmy. Right heart, low pressure. It has a systolic and diastolic pressure of about 25 over 15 because it just has to pump the blood to the lungs. The lungs, relatively small in comparison to the body. The left side of the heart has to pump that oxygenated blood to your entire body. So even though they pump the same amount of blood, they do so under different pressures. The systolic and diastolic pressure generated by the left heart is 120 over 80. Systolic, amount of pressure in the arteries when the left ventricle contracts and pushing blood through them. Diastolic, the amount of pressure in the arteries when the left ventricle is relaxed. So there is pressure in the arteries when the left ventricle is relaxed. So you have to pump that to the body. So the blood pump by the right heart is high in carbon dioxide, low in oxygen. Sends it to the lungs. What do you do in the lungs? You oxygenate it and remove carbon dioxide. So that blood from the lungs now comes back to the left heart. It's oxygenated. What does the left heart do? It pumps blood that's high in oxygen and low in carbon dioxide down to the cells of the body. Now here's the important thing. So watch. When the left ventricle contracts and sends that oxygenated blood through the arteries of the body, what's going to happen to the pressure of that blood as it moves farther and farther away from the heart and gets closer and closer to the cells of the body? The answer is that pressure goes down until you get to the level of the capillary and the cell. So what you have here is this. You have blood, you have the arterial end of the capillary, which is high in oxygen. Then you have the cell right here. What does the cell produce? Carbon dioxide. Where do things always go by diffusion? High to low. So oxygen goes from the blood into the cell. CO2 goes from the cell into the blood. And arterial blood becomes venous blood. That's why it's called circulation. So there is no separation between the arterial and the venous system. They're all connected together. And where gas exchange occurs is at the level of the capillary and the cell. All nutrients, electrolytes, you name it, occurs at the capillary and the cell. Now, here's the important piece. The pressure in the systemic capillary in the arterial end is like 15 to 20 millimeters of mercury. It's got to be low. Capillary is one cell membrane thick. If the pressure was higher, it would bust the capillaries. That would be bad for you. But as that blood excuse me, moves from the arterial end to the venous end, the pressure drops. And I'm just going to tell you this because it makes it simpler. In the venous end, there's no pressure. Write this down, tattoo it someplace. There is no pressure in the veins. So if you look, oxygen, and how they knew it was oxygen is as the blood moves towards the cell, it actually says oxygen. Come on, that's a little bit funny. So that blood now becomes venous blood. And this is the important piece. Please write this down. Please get it. What's the pressure inside the venous end of the capillary? The answer is 0. There is no pressure in the veins. So the question is, how does venous blood from your toes get back to the heart if there's no pressure? The answer is this. Write this down, tattoo it. I'm going to write it down for you because it's so important. I actually have this written down, painted in a mural in my bathroom down my basement. It's so important. And I look at it every time I have to go. There's no pressure in the systemic veins. Excuse me. The veins of your body. So, the question that has to be asked is, then, how does that venous blood get back to the right side of the heart? The answer is this. The largest veins of your body that store extra blood are deep inside your muscle. What does muscle do? It contracts and relaxes. Veins are unique. Veins, inside them, have one-way valves. These little valves right here. And these valves open up towards the heart. So if you ever watch like the 50 best beaches in the world, you'll always see that 70-year-old guy who's tan between his toes wearing the Speedo. And he's got these ratty, nasty looking veins that are all kind of twisted and jacked up. Those are called varicose veins. And that's because the veins, and specifically the valves, have gotten stretched out. So they no longer work so well. That's why little old ladies from Pasadena wear TED stockings, because TED stockings squish the veins and push that venous blood back towards the heart. So how do you, normal people, get venous blood back to the heart? The answer is that you get up and you move. And because you move, the largest veins of the body are deep inside muscle. And when the muscle contracts, it will squish those veins and force open those one-way valves. So that's how you get venous blood back to your heart. Well, your next logical question should be, well, gee whiz, Timmy, I'm not always walking. True that. So how do you get venous blood back to your heart if you ain't moving? Well, the answer is your heart is in your chest. So as you breathe, the pressure inside your thoracic cavity decreases, and that will literally suck the venous blood back to the right side of the heart. It's called the thoracic pump. So taking a big deep breath in will increase the amount of venous blood back to the heart. So if somebody had surgery, right, especially abdominal surgery, painful, right? It's muscle, they got to cut through the fascia, very painful. So Nurse Ratchet comes in, and she ain't being mean to you when she wants you to get up and move. She's doing that to save your life. Because when you move, you have to breathe deeper. And when you move, you contract and relax the skeletal muscle. And you will push that venous blood back to your heart. Listen up, because this is true. Blood that doesn't move clots. That's why when people come out of surgery, what do they inject into their belly? They give them an anticoagulant called Lovenox because they know that they ain't going to be moving too much. And doctors know this. They are afraid because these people ain't moving too much that venous blood that doesn't move clots. And well, that didn't work. If you form a clot in a vein, hang on, watch. I'm going to try and make this work. Well, it ain't going to work. But if you form a clot in a vein, you have a deep vein thrombosis. Where do deep vein thrombosis usually occur? They occur in your legs because most people move their arms, right? You can move your arms, but you don't necessarily move your legs. So if you're not moving, that venous blood will sit there and it has a tendency to clot. That's why if you go on a long plane flight, say maybe from Milwaukee to Chicago, that's supposed to be funny. Anyways, if you take a long plane flight, transcontinental plane flight, what did they tell you to do? They tell you to get your fatty acid up every couple hours and walk around. They could care less if you are comfortable. What they don't want you to do is die on their flight. It's bad for business. And here's why. Watch. Where do all the veins of the body dump their venous blood? Into the right side of the heart. Where does the right side of the heart send its blood to? It sends it to the lungs. So watch. Look. This is perfect. You get this, it's going to be good for you. I got some circles. I'm not erasing here. Wait. So watch. All venous blood returns to the right side of the heart. So when that venous blood returns to the right side of the heart, and you haven't been walking around, and then you start walking around, you can loosen a clot. When that clot gets loosened, where does it return to? It returns to the right side of the heart. The right side of the heart, big. That clot ain't going to affect any of the veins as it returns to the right side of the heart. But watch. What happens to the size of the veins or the vessels as you get deeper into the lungs? They get smaller. That's why a deep vein thrombosis causes a pulmonary embolus. And if it's big enough where it blocks the pulmonary trunk or a large pulmonary artery, these people die right now. That's why you get a person, if you're a nurse, you work on a surgical floor, you get their fatty acid up as much as you can. That's why respiratory therapy comes up and says, okay, light the clown's nose. Not only that, breathing increases venous return. Also, what kind of stockings do they have on after surgery? They have those sequential stockings that inflate and deflate when you're laying in bed because that mimics you walking. That mimics you contracting your muscles to increase that venous return back to the heart. So the sequential stockings, they inflate and deflate to squish the veins to bring that blood back to your heart. I hope you're with me on that. All right, so watch. Let's go back. Remember, the right and left side of the heart pump the same amount of blood. And there is a law that you are familiar with. You had anatomy and physiology, and it is called Starling's law. And Starling's almost simplified. Starling's law states that if you increase venous return of blood to the right heart, you stretch that heart. And when you stretch that heart, in a normal heart, when you stretch it, when you stretch the right ventricle, it contracts harder. Excuse me. And if it contracts harder, that increases the systolic blood pressure generated by the right heart. Please get this. Watch it. Watch it. Are you watching? What did I tell you? I'll never forget it. It was like 30 seconds ago. the right side of the heart and the left side of the heart pump the same amount of blood. So if the amount of blood coming back to the right heart increases, you're going to stretch the right heart. It's going to contract harder, and it's going to send more blood to the lungs. What determines the amount of blood pumped by the left heart? The amount of blood pumped by the right heart. So if you increase the amount of venous blood returned to it, you're going to stretch the right heart. That means more blood is going to be sent to the lungs, and that means more blood is going to come back to the left heart. If you send more blood back to the left heart, what do you do to it? I'm going to do it. I got to. If you increase the amount of blood in the left heart, you stretch it. And when you stretch it in a normal heart, you increase systolic blood pressure, increase the force of contraction, and the left heart generates more pressure. So if the left heart generates more pressure, your systolic blood pressure is going to go up. So watch. And again, this is critical. What determined the amount of blood pumped by the left heart? The answer is the amount of blood pumped by the right heart. What determined the amount of blood pumped by the right heart was the amount of venous blood that was returned to it. Get that? So watch. What's blood made out of? I don't know. 60% is water. So let's say, for example, you got high blood pressure. So the doctor says, we're going to lower it. So what the doctor's going to do is the doctor's going to give you a diuretic. What does a diuretic do? It makes you pee more than normal. It makes you pee more water. If you pee more water, then you should, because you're taking a diuretic. That's going to decrease your blood volume. If you decrease your blood volume, you will decrease venous blood back to the right heart. If there's less venous blood back to the right heart ain't stretched as much. Decrease stretch. Right? If you decrease the stretch of the right heart, decreased stretch leads to decreased pressure and decreased amount of blood sent to the lungs. Hold up. Watch it. Are you watching? What did I tell you? I'll never forget it. I told you. Never forget it. That the amount of blood pumped out of right heart is equal to the amount of blood pumped out of left heart. What determines the amount of blood pumped out of left heart? The amount of blood pumped out of right heart. What determines the amount of blood pumped out of right heart? The amount of venous blood returned to it. So if there's less venous blood returned to it because you're peeing out that extra volume, the right heart is stretched less, there is decreased force of contraction, and the amount of pressure and the amount of blood sent to the lungs is less. That means that the amount of blood coming back to the left heart is going to be less. That means the left heart is stretched less. That means the left heart won't contract as much, and the amount of blood pumped to the body and the pressure with which that blood is pumped by the left ventricle is less. That's how diuretics work. I hope you got that. And what I'll do later is I'll explain how the different diuretics work. And most of them work on the kidney to reduce your blood volume. And I'll explain some of the nursing considerations too. But this is really important, really critical that you understand this. Now, just an aside, real quick. So watch. Where do you store a lot of extra venous blood? You store it in your legs. I told you there's no pressure in the systemic veins. I actually wrote it too. This looks like veins, but it's veins. So if you are bleeding your own blood, and nobody makes me bleed my own blood, right? Dodgeball. If somebody's bleeding, where do you store extra blood? Venous blood in your legs. There's no pressure in the veins. So if somebody's bleeding, what do? You elevate their legs, and by gravity, all that extra venous blood that is stored in your legs will come back to the right heart, stretch it, greater force of contraction, more blood and greater pressure sent to the lungs. All that oxygenated blood comes back to the left heart, stretches the left heart, greater force of contraction, greater pressure, greater amount of blood ejected with each beat of the heart. So that's why when somebody's bleeding, you put them on their head. Say yeah. All right. I got to go to bed now. Be good. Study hard.